Safety and accident prevention related questions. Question: the mother calls the nurse to ask when her newborn will be brought back to her room to finish feeding. The mother states that a doctor came about 30 minutes ago to take the baby for an examination and has not returned with her baby. Which action should be taken by the nurse first? Options: A. Check the unit for the infant. B. Initiate procedures for possible newborn abduction. C. Ask other staff if they saw any physicians on the unit. D. Check to see if the doctor is still examining the infant. I repeat again the options: A. Check the unit for the infant. B. Initiate procedures for possible newborn abduction. C. Ask other staff if they saw any physicians on the unit. D. Check to see if the doctor is still examining the infant. Answer: B. The circumstances are suspicious enough to warrant initiating procedures for possible newborn abduction to retrieve the newborn immediately. So the answer is B. Initiate procedures for possible newborn abduction. Other options: rationale. A. Checking the unit would be included in the procedure for possible newborn abduction. C. Checking with other staff will delay getting the help needed to search the hospital and notify authorities. D. The HCP would usually examine the infant while in the mother's room and not take the infant to another location. Question: the nurse is discussing with the parents of the full-term newborn the infant's transportation in a vehicle. Which information should the nurse provide? Select all that apply. Options: A. The infant should be restrained in a car seat located in the back seat facing the rear of the car. B. The infant should be restrained in a car seat located in the back seat facing the front of the car. C. An infant car seat may be designed only for infants. If so, obtain another one when the infant reaches the weight limit for that model. D. A car seat should have a certification label stating that it complies with Federal Motor Vehicle Safety Standards. Answer is A, C, and D. A. The infant should be restrained in a car seat located in the back seat, facing the rear of the car to provide protection should an accident occur. C. Some models are for infants only, others convert for toddler use. Infants and toddlers should be in the child restraint device car seat appropriate for the infant's weight and size. D. Parents should only purchase a car seat that has a certification label stating that it complies with Federal Motor Vehicle Safety Standards. So the answer is A, C, and D. Question: the nurse is caring for the client who received afterload internal radiotherapy brachytherapy for treatment of uterine cancer. The nurse manager evaluates that the nurse uses correct hazardous material precautions when noting that the nurse takes which action? Options: A. Double bags linens before removing them from the client's room. B. Minimizes the amount of time spent in contact with the client. C. Maintains a distance of 1 foot away from the client. D. Wears lead gloves, an apron and a dosimetry badge with client contact. Answer is B. In afterload radiation therapy, the radioactive substance is inserted into the client in the client's private hospital room after prepared applicators have been placed in surgery. Exposure to radiation is controlled by minimizing the time spent with the client. So the answer is B. Minimizes the amount of time spent in contact with the client. Other options rationales: A. Linens should be kept in the room until the radioactive source is removed and the room is swept with a radiation detector to assess for spills or contamination. After clearance, the linens may be sent to the laundry. C. A 1-foot distance increases the nurse's chance of exposure to the radiation. The nurse standing 2 feet away from the source of radiation receives only 1/4 as much exposure as when standing only 1 foot away. D. Lead gloves and aprons are insufficient to block gamma rays during brachytherapy. Dosimetry badges measure the amount of radiation exposure and are not a precaution. Question: A healthcare agency has different receptacles for the various categories of institutional waste. Into which container should the nurse dispose of a suction canister used to collect bloody drainage from the client's NG tube? Options: A. Injurious waste receptacle, B. Hazardous waste receptacle, C. Infectious waste receptacle, D. Wastebasket in the client's bathroom. Answer is C. Blood and body fluids are considered infectious waste, therefore, the suction canister should be placed in the infectious waste receptacle, so the answer is C. Infectious waste receptacle. Other options rationales: A. Injurious wastes would include items such as needles, scalpel blades, lancets, or other objects that could injure another person. B. Hazardous waste includes radioactive material, chemotherapy agents, or caustic chemicals. D. Regular waste that does not pose a health hazard to others can be placed in a regular waste basket. Question: The client with a right femoral arterial line is confused, thrashing about in bed, and picking at the tubing. The HCP prescribes wrist restraints based on this information. What should the nurse plan to do? Options: A. Apply the wrist restraints as prescribed, B. Request an order for a right ankle restraint, C. Request an order for sedation instead of restraints, D. Question the order. Restraints will increase the client's agitation. Answer is B. An ankle restraint will help prevent dislodgement of the arterial catheter and bleeding, an injury that could occur from thrashing in bed. So the answer is B. Request an order for a right ankle restraint. Other options rationales: A. While applying wrist restraints will prevent side-to-side movement, it will not keep the client's right leg straight to prevent catheter dislodgement. C. Sedation may be needed in addition to the restraints. Too much sedation can compromise the client's respiratory status. D. While restraints can increase agitation, keeping one leg unrestrained may prevent this from occurring. Safety of the client is priority. Question: The nurse is teaching parents measures to prevent scald and burn injuries to toddlers in the home. Due to toddlers' inquisitiveness, which recommendation by the nurse is most important? Options: A. Turn pot handles toward the back of the stove, B. Use the microwave cautiously when cooking, C. Ensure that the smoke detector is on and working, D. Verify that the bath water temperature is tepid. Answer is A. Toddlers are curious, and if a pot handle is easily accessible to a toddler, the toddler may grasp it and experience a scald and burn injury. This is the most important recommendation among the options, so the answer is A. Turn pot handles toward the back of the stove. Other options rationales. B. One cause of a burn injury may be providing food that is too hot to a toddler, and this can result in a burn injury, but this option does not address the inquisitiveness of toddlers. C. The parent should ensure that smoke detectors are working properly to prevent burn injuries from a fire, but this option does not address the toddler's inquisitiveness. D. Tepid bath water is only lukewarm and would be uncomfortable for bathing a toddler and is unnecessary. Warm water that is not too hot is appropriate for bathing.